Good evening once more, and welcome to the Womb Care Clinic Scars of Womanhood series. This is the third episode of the series that we're doing, and today we're going to touch on a very, very important topic, and that is teenage pregnancy. Thank you to everybody that has logged in. Thank you to everybody that's going to watch this, even recorded. You're most welcome, and I am absolutely excited for this particular episode. On our episode today, we have a woman that I met, I think, more than 3 years ago. And, it's one of those things where somebody comes into your life and they're an absolute superpower. They're an absolute person that just changes your perspective of life, the way that you get to hustle, the way that you get to push, and the way that you get to look at life in general. Allow me to introduce Mrs. Bwalya Magawa Chomba, a healing woman who is shaping policy and she is changing Zambia. Bwalya Magawa Chomba is a distinguished Zambian social worker, public health specialist, and maternal health advocate with over 20 years of experience in community development and women's health. She currently serves as the country program director for Fistula Foundation in Zambia, where she has championed the expansion of fistula treatment services across 7 provinces, supporting more than 2,600 life-restoring surgeries and leading nationwide awareness campaigns. She holds a bachelor's degree in social work from Mulungushi University and a master's in public health from UNILAS. Her leadership has been instrumental in shaping national health policies, training thousands of community leaders, and strengthening partnership with hospitals, governments, and grassroots organizations. Recognized as a 2023 Heroine of Health by Women in Global Health and awarded the 2025 Z Catalyst for Change Award by Zanaco's Women's Banking, Bwalya continues to inspire change and restore dignity for women affected by maternal health challenges. Her personal journey, including overcoming secondary infertility, which is something I definitely look forward to hearing from her in future, fuels her passion for advocacy and breaking the silence around women's health issues. Beyond her professional work, she is proudly a wife of 25 years and a mother of 2, a role that grounds her and adds depth to her mission of building healthier communities. Her personal philosophy is simple but yet powerful. Just because the rivers are calm doesn't mean there are no crocodiles. Mrs. Chomba, thank you very much for gracing us with your presence, with your story. You're an absolutely superwoman. You're an absolutely superhero. Good evening and welcome to our Scars of Womanhood webinar.
Thank you very much. Good evening and good evening to everyone who has joined in. Wow, this is too much. I'm so humbled. Yeah, I'm so humbled to connect with everyone and have an opportunity of sharing this story. And I'm dedicating it to my son, who's graduating on Friday. Yeah, you'll hear more about him. Yes, thank you.
No, thank you very much. I think if you're saying you're humbled, I am beyond humbled. And on behalf of the team at Womb Care Clinic, we are absolutely honored to have you. And we look forward to hearing your story because what you went through, where you are right now, you are beyond a hero. You are an absolute champion. My name is Dr. Mweemba Musoba. I'm a consultant obstetrician and gynecologist at Womb Care Clinic. I'm also a fistula surgeon and I'm a fertility fellow. Allow me to just take you through a short overview of teenage pregnancies before we come to the star of the show. This article caught the attention of our country 3 years ago when it was recorded that 1,600 Solwezi teens were pregnant. So this number includes hundreds of girls aged between 10 and 14. So this actually sent a bit of shockwaves in our country because 1,600 teenage pregnancies just within Solwezi town is an extremely high number. So what is teenage pregnancy? So, teenage or adolescent period is the phase between childhood and adulthood, which spans from the age of 10 to 19 years old. During this period of time, it is a unique phase where one undergoes rapid physical, cognitive, and psychosocial growth. So, there are a lot of changes that begin to happen to one's body. And any pregnancy that occurs during this period of time is defined as teenage pregnancy. If you look at some of the facts that surround adolescence in general, you find that currently, globally, about one-sixth of the world population is adolescents. And if you find that the risk of death for 15 to 19-year-olds is actually related to alcohol and unsafe sex. And when it comes to pregnancy complications and unsafe abortions, you find that these are the leading cause of deaths among girls that are between the ages of 15 and 19 years old. And if you look at what WHO mentioned in 2019, we found that adolescents, especially those aged between 15 and 19 years old in low and middle income countries, had an estimated 21 million pregnancies each year, of which 50% of those were unintended, and there was an estimated birth rate of about 12 million. In Zambia, 29% of adolescents between the ages of 15 and 19 have been pregnant before or have given birth. Globally, if you look at the adolescent birth rate, you find that it has actually reduced from 2000 to 2023 from 64.5 per 1,000 to 41.3 per 1,000. And when it comes to adolescent mothers and their babies, they face very high maternal and neonatal complications. And you find that 55% of unintended pregnancies amongst the adolescents actually end in abortions. And when we talk about abortions, we ask ourselves, are these safe or unsafe abortions? And just like earlier mentioned, pregnancy complications and unsafe abortion are the leading cause of death among girls between the ages of 15 and 19. So why do teenage pregnancies happen? You find that some of these are multifactorial. So there is a lack of sexual education or sexual knowledge, which might be a lack of or an inadequate one. And this comes down to religious beliefs, culture, and several taboos that are actually involved. Then there's also alcohol and drugs. We know that the teenage period is one where there's a lot of experimentation, one is growing, and you find that an abuse of alcohol and drugs can lead to a loss of inhibitions. There is also a lack of access to contraception that is offered to these teenagers, and this can be due to a lack of proper clinics around, or even just the social norms that are actually there, religious beliefs, the cultures, and several taboos that are affecting this. Then there's the social economic status, which actually plays a key role in these teenage pregnancies. And what are some of the complications of teenage pregnancies? So you find that teenage pregnancies are ones that can complicate a lot. Why? Like I earlier mentioned, the body is undergoing through so many changes, physically, emotionally. So you find that most teenagers do not even understand the need for example, early antenatal booking, which might help them prevent certain complications that might happen to them or the baby. So some of the maternal-related complications are diseases involving hypertensive complications such as preeclampsia. You find that there is diabetes or sugar that comes in during the pregnancy itself. Depression as well, due to social stigma, can come into play. And you find that there might be complications during the delivery process. I've seen a lot of teenagers undergo delivery, and you find that because of the pain, which can be unbearable, you find that there might be tears that might happen, there might be bleeding complications, and they've got a very high risk of operative type of procedures. Then there are those infant related or baby related complications, such as preterm delivery, low birth weight. There might be fetal growth restriction, which is when the baby's size does not match the age of the pregnancy. And there might be infant death as well, which might happen whilst the baby's in the womb or during the early lives of the baby. Adolescent parenthood is challenging. family and social support is crucial to mitigating the adverse socioeconomic outcomes associated with adolescent parenthood. And I think this is a very important take-home message in which we need to offer that support as family, friends, and even as society in general. Like I said, this is definitely not my show. This is a show of a woman who is an absolute inspiration. And having gotten to know her as a colleague, as a mentor, I told her that her story is a story that just needs to be told. And fortunately enough, she did agree to tell her story. And I'm absolutely excited for everybody to hear her stories. So we'll go through a couple of questions, and Mrs. Chomba, feel free to just take us through. So let's start from the beginning. Can you take us back to the moment you found out you were pregnant? What was that moment like?
Thank you very much. I was in second year at the Copperbelt University. I was studying a Bachelor of Science in Engineering in building. My parents wanted me to become an engineer. Yeah. Sorry, it's an emotional moment, but I'll try as much as possible. It's the
No
first
problem.
time I'm talking about it to a huge, yeah. Yeah, so what happened was that I didn't even know like the signs, symptoms of pregnancy. I didn't know anything about that because I didn't have so much information about pregnancy, even sex before marriage or anything. I came from a mission school, St. Teresa Girls. I completed school in 1997 when I was 16 years old, and we never had information about that. We had one teacher who used to talk about Chisungu ceremony, but not so much about the real sex education. And the home where I was coming from, I come from a very, I can say, strict family. My mother is very strict. She's a no-nonsense person. Even up to now, there are certain decisions I can't take because she's always in my picture. Like I will think about her. So we never had a moment really to talk about like sex education or like relationships. This is how you can handle a relationship. I never had that information. And I was coming from this secondary school. I never had a boyfriend before. So even when I went to CPU, I met my husband 3 days after I went to campus. And he was just a friend. For me, everything was just friendship. So when it comes to sex, I used to hear my friends talk about it. Like everyone was talking about how sweet this thing is. And I was looking forward to experimenting as well to know what is this animal called sex and what can happen. Yeah. So I was in this relationship like for the whole year, and it never involved, it wasn't a sexual relationship until close to the end of first year. So when I became pregnant, I didn't know that I was pregnant. I just used to have fever. Yeah, fever from the blues. I had fever and I felt I stopped going to class. I used to vomit a lot. Whatever I eat, I could vomit. So I told by then my boyfriend to say this was happening, and he had just finished school because I found him in fifth year, me, I was in first year. So I went to the clinic as somebody who was expected to have malaria because that was the only thing I knew. So when the clinical officer did the test on me and asked me if I had a boyfriend, so now that's when it came to my mind because he said, "Do you have a boyfriend?" I said, "Yes, but I've never slept with him. I've never had sex before." He said, "No, we haven't reached that far. I'm just asking you, do you have a boyfriend?" I said, "Yes." "Okay." He gave me that container. "You should bring your urine." So I told my boyfriend to say, "This is the situation. They want to test for urine." The funny thing I remember up to now was we agreed to say, "Okay, we'll take his urine to the clinic, the CBU clinic." For it, I really don't understand up to now what was the rationale. We're just in that state where like you're in denial. But I ended up taking the urine and I was told that I was pregnant. Wow, it was something I really cried that night. I remember I cried very much. And he was there comforting me, no, Bwalya, we'll handle this, we'll go through this together and all that. Then I told my roommates, I had to share with my roommates. We were four in my room. So these friends of mine, I shared with them, this is what has happened. So now the issue was on how to break the silence to the parents. So yeah, I kept quiet about it. We were about to close. So we
Hello. This is what I think we have
closed
lost
and I
you.
went home for holiday. I remember, yeah.
Yes, we can hear you now. I think I lost you on my end. I don't know that everybody lost you, but you can go ahead, please.
Okay. Yeah, so I was saying that I are you getting me?
Yes, I can get you now. I hope everybody else on the call is getting you.
Yeah, the challenge with internet. I'm trying to change.
Okay.
Loud and clear now.
Oh, okay. Yeah. So one day I was going to the market with my mother. We were just the two of us in the car. She looked at me and I was scared. I thought she had known. Then she said, Bwalya, there's something I really want to talk to you about. As you are going back to school tomorrow, I want you to know that in case you become pregnant, don't abort. In case you become pregnant, don't abort. But I wouldn't want you to become pregnant. I would be very, very upset with you, but I can't kill you. So please don't abort because abortions kill a lot. Yeah. So now I was like, does she really know what is happening? So I just insisted that the following day I had to go back to CBU. I had a test. So this time now, this is when I thought about it to say, I'm sure she knew, but maybe she was just in denial. So I stayed without telling my mom or without telling anybody else. And life continued. I used to go to class and the like. My husband by then went to Harare, Zimbabwe. That's where he was working from. He got a job. So when he wrote me a letter and the pregnancy was growing, I thought, what am I going to do? How am I going to force to face my parents? So I had to run away. I ran away from school in the evening. I didn't tell anyone. I just left off all my things. I just went with a small bag and the passport, which I had already organized, got on a bus from Kitwe to Intercity in the night. Early in the morning, I boarded the bus to Harare to go and meet him. So that was the moment when I became pregnant. That is what happened. I found him in Harare. He picked me up from the station and we started staying without telling my parents. So we stayed for 4 months. They started looking for me at home. They had to travel to Quito to look for me. So his friend knew where we were living in Harare. So when my mother said she was taking him to the police, that's when he confessed to say I'd run away to Zimbabwe because I was pregnant. And my parents were very disappointed because I'd left school. For them, the interest was school, nothing else. So they had to come to Zimbabwe to look for me with that address. And they fetched me from Zimbabwe and brought me back. They took me back to CBU, to school. And by then, the pregnancy was very big. So now everyone in class was like, oh, she ran away. Now she has come back. The parents have brought her to write the exams. So that is how it was.
Oh, um, it was sounds like it was quite an emotional journey, and
Yeah.
I think I was picking up on a few of the things that you were saying, where you're talking about coming from a mission school, and it sounds like it was an all-girls school where sex
Yes.
education was not really at the forefront. And even at home, that aspect of things wasn't really at the forefront. And where you get pregnant and you don't know, you're just finding yourself sick, the vomiting, the fever, and you're wondering what it is that is going on within your body, which is quite a scary moment. And I think you put a lot of brave moves. I mean, to move all the way as a 19-year-old from Ndola to Zimbabwe by bus, pregnant. I can't
Yeah.
even imagine such a movement. So in this part, I know you've touched a bit about it. Family, your partner, your friends. These are the people that matter to you the most. How did they take this news?
So for my family, by then it was just my mother and father. They never shared that information with anybody else. First, it was just with the two of them. I expected them to be very mad with me, like to beat me or something, because that was what I was expecting. But nothing like that happened. My parents were very supportive. My mother was very supportive. She started talking up to me about getting back to school, even that, no, you get back to school and we'll keep the child and everything. Yeah. So they even came to, when they came to Zimbabwe to look for me, I locked myself in the house for like maybe 2 hours. They were just pleading with me. The neighbors came, no, you won't be beaten, just come out. You won't be beaten and all that. And then my partner was just crying. Yeah, he was just crying. But on his side, being supportive, I think he's the one who even made the journey easy because he was very, very supportive. From the moment I told him that I was pregnant, he wrote me a letter, which up to now I still have. And in that letter, he mentioned that he was going to look for a job so that he would take care of that which is to come. He doesn't want to burden anyone. So that's why he even decided to move to Zimbabwe, where he had done some attachments before to go and work from there. So he was very, very supportive. Even my friends, this wouldn't go unmentioned. In my room, I was staying with Cynthia Kanema, the former Miss Zambia, Alice, Sharon, yeah. All of them, the three of them were very supportive. Then I had a friend also. She's still my friend, Luenga, the owner of Plus Pev. She had a child. She came pregnant to CPU. So she was a strong support system. So I had those people who surrounded me and really took care of me, encouraging me. So I didn't have a problem with that. And that's why I never contemplated abortion, not even at any point. There was a time when one of my neighbors mentioned to say, at CBU, just across the road near somewhere there was a clinic where people used to go and abort. So I was given that information to say, maybe you can do that. I said no, because I was already in love with that child whom I had not seen. And and I was so much in love with my partner and the support I was getting. So I just said, I'll pull through this. Yeah.
Oh, that's really, really nice. And I think your partner should get a major shout out, because for him to even write you that letter, and I'm sure you really treasure that letter, to say, I'm going to work hard for us as a family.
Yeah.
I'm sure that did give you the strength, and to have friends like you are
Mm-hmm.
saying around you who helped you through the journey, that was definitely very helpful. And I can imagine the fear of getting bitten. I think growing up in an African home, I think that's the first thought that comes to our minds when we have such things. And it's amazing as
Yeah.
well that your family was there for you and supporting you throughout. So this was you getting pregnant in university. And this was in your
Yeah.
second year of university, when you're just supposed to be now like fully settled, you've already passed the freshman period, and it's now your
Mm-hmm.
time to own the university. So how did being pregnant in university affect your studies and campus life? And did you feel that you were supported during this period of time by your lecturers and the university itself?
This one is two-way. Sometimes there's that aspect of being bullied, especially when the pregnancy becomes big. You're passing, the monks are seated, and they will just boo as you're passing. And also in class, I was in a class where we were not more than 10 ladies, about 8 ladies, and about 40-something guys in the Bachelor of Science, a Bachelor of Science in Beauty. So some were supportive, some they would boo you like that. But yeah, of course, the privileges, maybe when it's time to get busy, you'll be taught to go in front. Yeah, when there's something happening, no, you can just pass, this one. But sometimes they will boo you and all that. So it was 50-50, but it really affected me because I was failing to study. I became very, very sick. I was very sick. I vomited from day one up to the last day. Whatever I eat, whatever I put in my mouth, I could vomit. So most of the time I was just sleeping. I was failing to go to class. And even when I was taken back to CPU to say I write the exams, because my parents just said, there's no way you're stopping school, you're going to write the exams. So when they went back home, I had to make my own arrangements. I went to the dean. One of the lecturers advised me to say, no, you won't pass. Just go to the dean and get a letter so that you withdraw from studies. So I did the withdraw from studies. But again, when I thought about going home, it was something else. I said, no, I can't go back to Mbika. I know my mother is just, she's just doing this, but one day when she gets an opportunity, she will beat me. And I was running away from that beating. So when I told my partner about it, he said, no, just come back to Zimbabwe. Again, I went back to Zimbabwe the second time. So when my parents learned that I was in Zimbabwe, they just said, no, this time we won't come for you. He's the one who will bring you back. And he was given an ultimatum to take me back home to go and deliver from home. That time I didn't even now pass through campus. Yeah.
All right. So it seems you had one of those pretty rough pregnancies, because for you to be vomiting throughout, to be sort of ill, it seems it was quite a heavy pregnancy. But like you said, I think 50-50, I can understand how monks can be quite mean by virtue of being monks in campus. And I can understand the support as well that you managed to get. So it seems it was quite a 50-50, like you've put it, in terms of the experience that you've had. And then you've already spoken mostly about your health in terms of how it was, but how would you describe your antenatal journey? And did you face any difficulties or judgment from healthcare workers when you're accessing these services, either back home or even when you are traveled to Zimbabwe?
Back home, I faced challenges. The first antenatal clinic I went to was at Buchi Clinic. Yeah, so I was told by CBU to say you should go to Buchi Clinic to go and register for antenatal. So when I just mentioned that I was a student, so the nurses were very mean. They started talking, no, these children of nowadays, look at her. She's just a child. How can she be pregnant? Parents are suffering to pay for your school fees and all that. So that made me shun antenatal. I never went back for antenatal. I just left it. I said, whatever will happen, let it happen. Then when I moved to Zimbabwe, because now there was an aspect of saying I might deliver from there. So there I had to register for antenatal, and I used to go, and they used to treat me very well. Because for those people, there was not even an aspect of them knowing that I was a student. They didn't know that I was a student. They just knew that, oh, there's this Zambian girl who's married to that Zambian engineer in the neighborhood. And that was the end of the story. Yeah. So there I used to go for antenatal. Yeah. I didn't have a problem. But even when it came to delivery, I had a problem. I delivered from within Zambia. So when it came to delivery, the hospital I went to, when they just looked at the card and knew that I was a student, I was in labor. I could say, I have this problem. It's paining. Come and check on me. They used to refuse to check on me. No, these children of nowadays, you think just because you're a university student and you can. So I was in labor for like 3 days. And then on the fourth day, when the doctor was passing, unfortunately enough, one of the fistula surgeons I work with now is the one who even operated on me that time. So yeah, when that person was passing, what is happening? This one, I just remember hearing the meconium stain or something. I didn't even understand by then what it meant. Then I was asked, the nurse started explaining in English. No, we didn't even know that the labor had started and all that. Then I said, no, it's not like I don't understand English. I'll stand up for myself. I explained. So the nurse wanted to do that, like trying to say, no, but we attended to her. I was just meant to sign. I was asked, where are your parents? Where is your mother? I said she had gone to make tea for me. So I was told, can you sign for yourself? I said, yes. That's how I signed, and I had to undergo an emergency cesarean section.
Oh, um, I think on behalf of healthcare workers, allow me to just apologize. And I think maybe
After.
part of what you went through is the reason why even most health facilities have got adolescent friendly corners, where adolescents can actually access health services without judgment, because that judgment that you did go through. And I think somehow in all of this, there was destiny on your son to be where he is, just like you said, you've dedicated this to him. Because I can't even imagine if you had stayed within Zambia with the type of attitude that you had received at that point in time, if you had undergone proper antenatal care. Just like you said, you didn't want to go because of the judgment. And even what
Yeah.
you're talking about in terms of meconium stain, I think for people out there, that's one of the major reasons why a woman might undergo a cesarean section, because it just means that the baby has actually pooped inside the uterus. And that is a bad sign, because the baby shouldn't be pooping during the labor process, because it means whilst the baby is sitting in that sac, might end up choking, if I can put it that way, on that poop that is in there and that is passing through the system. So you find that that's one of the major causes of or major reasons why people or mothers actually undergo cesarean delivery. But I think we're grateful that at least your son is doing well, and there were people who were placed in your path, like the fistula surgeon, who is now a fistula surgeon, who was there to have taken care of you.
Yeah.
So now, this whole journey, I think, is one that is filled with emotion. And just like you said when you started talking, that it makes you feel with so much emotion, even as you're thinking about it. What was the hardest part of your journey, and how did you push through? Where did you find the strength that carried you through this particular journey?
The hardest part was the physical pain. Being sick, I was very, very sick, but there was no aspect of going to the hospital like somebody. What Zambia is known for, power cut. Yeah. So the physical pain, I used to become very, very, I was very sick. So that thing where I couldn't eat anything, I can say for the whole lot of the 9 months and all that, I was just sick, the fever. Every day around 13 hours, I could just be in blankets, whether it's hot, whether it's cold, I could be in blankets. So that one was very difficult. And also, yeah, the emotional aspect, the depression, where you are not so sure of what that which is to come, where you are believed in so much, you are an student, and this is a person everyone is looking up to you. She'll become an engineer. So I used to think about my career so much, like, what next? So what will happen to me? How am I going to leave this child? And just the being torn apart between the child and also getting back to school, because the interest so much, in as much as, yes, my parents were interested in me having this child, but for them, their concern was also so much on school, because all the time there was that mention, you have to get back to school. Even when I gave birth, I had to go back to CPU when the baby was 3 months old, and I didn't have an opportunity to win off the baby. I was just taught to say, tomorrow you are opening school, so you have to go, whether you like it or not. We found a maid who will be taking care of the baby, and the baby will be on milk. From the day when the baby was born, he could be drinking, he used to drink lactogen and also breastfeeding. So I just went like that. So there was that emotional aspect, the depression, the thinking about the child all the time. And I didn't last even in university, because my mind was always back home. That's why, again, I just had to run away. I had to stop school and go back home to take care of the baby.
It's like you said earlier on, you said you didn't think about abortion at any point in time because you had fallen in love with your baby already. And it seems like, you couldn't even stay away from your baby and you had to go back. And I think it was something that took you through a lot of emotions, as you have put it, more especially talking about depression and thinking about what next, how do I make it through? And it's quite something. So where exactly did you find the strength to pull through?
So the strength to pull through was in the partner. He was there for me all the time. He never left me. He was there for me all the time. When he brought me back from Zimbabwe, I was still pregnant. He took me to Mbika to deliver. That's how he resigned. He stopped his work. He just resigned. He said there was no way I could get back to Zimbabwe and you are very sick this side. I would take care of you and wait for you until you deliver. So the strength was in him because he was there all the time for me. Yeah.
That's amazing. That's really, really amazing. And kudos to Mr. Chomba for standing up as a man, actually. And I think it's something that we rarely get to see in our society, with a lot of fathers, or yeah, fathers, maybe some we can just call them sperm donors, running away from their partners when they're going through what you went through. And it's amazing that you had such a pillar of strength to guide you through that particular one. So absolute kudos to him. So lessons and hindsight. They say hindsight is a beautiful thing because every time we get to look back, it seems as if everything was clearer than we actually think it was. So now looking back and knowing all that you know, what would be your message to that 19-year-old you who was actually going through what you went through? And what would be your message to the young people out there that might be going through exactly what you're going through?
Mm-hmm. Yeah. So message to the young people out there is to wait a bit before having a child. Really, it's not easy, even if you have a supportive partner, because you are the one who has to bear the physical consequences. They are just those consequences which you go through, even the emotional aspect. For me, my advice is to wait. Yeah. For a person who cannot abstain, I know people would get back at me and say, but you are a Christian and why are you encouraging this? But for me, I would rather encourage contraceptives for teenagers. Yeah. Because if we become naive and say sex is not happening among teenagers, we are lying to ourselves. The best method, of course, the number one is abstinence. But if someone cannot abstain, let them go for contraceptives. That's the advice I can give. Yeah. And also, to this time we have messages all over.
Sorry about that. Just muted the person. Please go ahead.
Yeah. So and make use of the friendly corners. We should find the teenagers, the young girls, let them find themselves in safe spaces. Let them have people they can trust, people they can ask, and people who can guide them through this journey. It's not an easy journey, but it would be nice to have someone who's guiding you through, and also the friendly corners, making use of the friendly corners, learning about all these things. This time, there's a lot of information out there. There are a lot of programs for young girls, for young boys. Let them go through those lessons and learn something from it and just abstain. But if they can't abstain, let them go for contraceptives.
Thank you very much for that piece of advice. I think to the young people out there, which is abstinence key. Find yourself support groups that will help you understand what you're going through, visit the youth-friendly corners that are in almost every health facility where you can get this health education, sex education talks. And if you must, it's important that you actually use contraceptions, because contraceptions will help prevent pregnancy. And even in our last webinar, where we were talking about contraceptives, I think the one thing that came to the forefront is that only a condom, which is barrier method, will help prevent both pregnancy and also sexually transmitted diseases. So I think that is something that is very, very important. And thank you for that advice. Our final question, and this is a question that I always ask all the women and all of the heroes that come through. What does scars of womanhood mean to you?
For me, it means scars like the physical scars, the emotional traumas I went through, they'll still be there, but it's something which I've learned to live with. And yeah, but the most important one is the badge of honor, because my son is with me. That time it looked very difficult and all that. My son is my best friend. Yeah. And he's just finished his school, his Bachelor of Economics and Finance. He'll be graduating on Friday. So my badge of honor is now my degree. My CBU degree is getting a degree. So I'm very excited about it. Yeah.
No, that's absolutely amazing. And for people that don't know, Mrs. Chomba is now based in Tanzania. She works for Fistula Foundation. She's doing amazing things when it comes to women's health, women that have suffered injuries whilst giving birth. And that's where these fistulas come into play. So you find that a woman suffers this injury that just alters her life, where she just starts leaking urine or starts leaking feces through her vagina. It is quite traumatic. It is quite a very, very sad and depressing disease. And she works with a team of doctors, team of nurses that go around healing such women, offering them free surgeries to such women. And just like we'd mentioned in the preamble, through her leadership, more than 2,600 women have been treated and are doing very well, which is absolutely amazing. And she's here right now in Zambia because her son, who she had in university, is actually graduating from university. And I think it was just symbolic. It was written in the stars that should come in now and talk about your story.
Yeah, it was. Thank you very much.
I've asked a question in the messages.
Okay, sorry. We'll definitely look at those questions. I think we've come to the main part where Mrs. Chomba shared her stories. She told us what's happening. And if we look into the chat box, there's a comment which says from Mrs. Terrence, the attitude is something that requires to be talked about all the time in our health professionals. I totally agree with you. It is something that needs to change. It is something that needs to be hammered down. I know we are not all the same, but we always get bunched up together and it seems like, one rotten apple just ruining everything. But it's something that we'll constantly talk about. Sandra says, indeed, Mr. Chomba needs to be recommended. I absolutely agree with you. Univa Kunda says, thank you so much for sharing your story. What advice can you give a mother whose teenage child, first year university, just had a baby? The girl kept the pregnancy as a secret, and this mother only discovered on the day she gave birth. Right now, the mother is somehow depressed. She's always crying each time, and each time she talks about her experience with her daughter. What advice would you give the girl and the mother?
It's unfortunate that the mother did not have the information until the girl had to give birth. For me, not judging her, but it shows the relationship, the kind of relationship which they have. And that is something which we have to talk about as mothers. We really need to develop relationships with our children. Our children should see us as the place of safety, the number one place of safety. They should be able to share with us these things when they are happening. I would advise her to accept that and embrace her. The girl should not be forced into school, to be rushed into school because she might not be able to concentrate. She should be given an opportunity to take care of the child until such a time when the child is weaned off. That's when they have to sit down together with the girl and then come up with a plan. They plan together. If she's in the plan of taking her back to school, that one will work very well.
Thank you very much for that piece of advice, and thank you very much for that question, Univakunda. I think this particular question tackles two aspects of things. Number one, it tackles the mother's reaction to everything, and I think she is depressed, like you have put it. One, because her child, I think, had a child, went through the whole pregnancy period without the support of a mother. And I'm pretty sure as a mother, she would have wanted to be there. And it brings about a lot of questions in terms of how their relationship is if she was so scared that she can't even speak to her mother during such a time when she needs a parent, more especially if your parent is actually alive and well. And I think maybe that's what speaks the most to her heartbreak and depression. And I think it's important that the two of them find a good counselor so that they are able to share their sides of the story. The daughter has to share her side of the story, how she went through what she went through, and why she thought it wasn't prudent for her to tell her mother. And her mother as well has to share her side of the story as well. Because I believe parents raise us the best way that they can. And it always becomes disappointing if they feel as if the way they raised us is somehow they failed us in any way. So I would suggest that they do find a good counselor that they can sit down with, they can have a chat with, so that they can be able to start healing. Because now there's a child involved that the mother has to be a grandmother to, and also the girl has to be a mother to as well. So there's a comment from Sandra Kaumbwa, which says, in my opinion, I encourage that she seeks medical advice. Depression comes out due to different reasons and can lead to mental health stress. If you can find a counselor, it will help. I totally agree with you. Chibesa Sekeleti says, congratulations to your son on his graduation. I'm super proud. Sandra Kaumbwa says, indeed, Madam Chomba has been my lifesaver. I'm facing life positively because she helped me get treated with a fistula. Congratulations to you, Madam Sandra, and happy you're facing life positively. I'm very happy as well, Mrs. Chomba. These are people that you have touched and are forever grateful. So you should know that you've got an army of people behind you who are always willing you on and championing you on. Chibesa has asked a question. Any advice that you would give to parents how to help the girl child avoid teenage pregnancy?
Talking sex education is very important, and not just to girl children, even to boy children. This is something we've really held on so much because of our culture. We are not allowed to speak about sex. It's a taboo in our families. But at the moment, the situation we are in right now, we just have to be talking to our children. We have to talk to our children. We have to give them sex education. Yeah. For the things which we feel we cannot talk about or they seem like hard for us to talk, we can engage other people. Like I would give an example. For me, what I do for my son, because I work with different people like you, Dr. Musoba, and everyone, the Kwangus, these young doctors I'm working with. And I feel these can relate very well with my son at some point, maybe just like peers. So I would always give that information to say, can you find a way of befriending my son and talking to him about these things? Yeah. So it's the sex education, we have to talk about it. We have to start breaking the silence. This is something which we've been very silent in our culture. We don't want to talk about it. We are just quiet and we just expect our children to navigate as they grow up. Look at what is happening right now. A lot of things are happening. There's a lot of information out there. Children are engaging in all sorts of vices related to sex. So it's better we start breaking the ice from home. We talk about it. Then we talk about it, and then we expose our children also to things like support groups, youth groups. They find themselves busy in these games, the youth groups, the friendly corners, anywhere where they can get the positive information. Yeah.
Thank you very much for that advice. And I'm glad you've looked at it in terms of even just the boy child, the girl child. And we definitely need to be able to speak up, and we need to educate, because there is information out there. And with the age that we're living in, where technology, children have phones at very young ages, they get so much information. And I think it's our duty, even as parents, to be able to change the narratives of that particular information. Chisanga Natasha says children need to be taught about sex issues to avoid such. We shouldn't be hiding them. I totally agree with that. Sarah N. Ngoma says, I pray that scars are cleared and you're happy to tell you the story with love. It's definitely a story that has been told out of love. Chisanga Natasha says we need to have good relationships with our children. Let them be our friends. Very, very important. Hiding information from children makes them experience a lot of things. Totally agreed with Sanga. Univa Kunda says, thank you very much for your response. You're most welcome. Sanga Natasha says, don't wait for a child, to go and learn things from outside. Start it from home, which is absolutely true. And then she also says, congratulations to your son, madam. Congratulations are definitely in order. Chela Mwambo says, I agree with you, Mrs. Chomba. The home is the best place to start sex education in order to save them from what's outside there. Very, very true, Chela. It's something that needs to start from home, where information is given accordingly and it's a safe space for people to discuss. Chibesa Sekeleti Msoa says, very true. Ukufunda omwana kufikapo, which just simply means in Bemba, if you have to teach somebody, you have to reach the actual point, the root cause, if I can put it that way. We have to get comfortable with uncomfortable conversations, which is something that is very important. Martha says, great talk, learning a lot. Takuza says, congratulations to your son, mom, and congratulations to you too. You're such a brave woman. So I think I've gone through almost all the messages that are in the chat, and I thank everybody that logged in. For those that did miss out, this is a recorded program, and we will upload it on our YouTube page, which is Womb Care Clinic, where you can access it. At this point in time, first of all, on behalf of Womb Care Clinic, Mrs. Bwalya Magawa Chomba, we just want to say thank you for being such a brave woman. Thank you for being an inspiration. Thank you for taking time to share your story, which is a story that has been shrouded with so much emotion, so much trauma, but yet one that makes you stand today to attend a graduation ceremony of your son. Please congratulate him on behalf of Womb Care Clinic. I'm sure you'll ask, who is Womb Care Clinic? But just tell him we absolutely congratulate him. Please feel free. This is your show to give us your closing remarks.
Thank you very much. Thank you very much to everyone who tuned in. And I would encourage, I'm really emphasizing that let's have relationships with our children. We should be talking about it. I remembered one thing which is not related to teen pregnancy, it's related to HIV/AIDS. And there was a time I worked for an HIV/AIDS program under the Catholic Relief Services. So we were talking about the youth and sex education and all that. So you find that mostly the information which these children have been having, or which we were having as a child, is if I get married as a virgin, or I'm a boy virgin, I'll meet a virgin and all that. But this time with HIV and AIDS, the era we are in, those children who were born with HIV, they've grown up and they are at that age. So that is also something which we really have to take care of as we are talking to our children, that we are no longer measuring being healthy by being a virgin. It's no longer like that anymore. Things have changed. The narrative has changed. So we really have to give them all that information from home. Thank you.
Thank you very much, Mrs. Chomba, and thank you everyone that logged in for this particular webinar. We're very grateful. Do stay tuned for our next series, where we'll have another superhero of a woman who will come and give a talk, and definitely Mrs. Chomba will be back in future. Thank you very much, and I wish you all a very lovely week.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.